Zuckerberg San Francisco General. We have our remarkable speaker here, Nancy Pelosi, and her constituents and my neighbors, Aaron and Jakob Lubin and their daughter Zosha, who will give us some remarks today. Preethi Krishtel, who's the Executive Director of Initiative for Medicines Access and Knowledge, and Peter Lee, who's the Executive Director of Covered California. Thank you. So I wanted to say one thing about why it's so wonderful that all of these guests are here on our campus today to speak about healthcare affordability. And that's because of the work that we do on behalf of the community. We serve almost 100,000 people a year, providing them all different types of health care that they need. And the folks that we serve are among the most vulnerable in our community. They have medical issues, they have social issues, they have all kinds of things that keep their health care sometimes unaffordable and challenging. And before the ACA was put into place, 40% of our patients were uninsured. Today, almost all of them are insured. And this is because of the work that Speaker Pelosi and colleagues in Congress have done, and so it makes it even more important that we're all here today to talk about this incredibly important topic. So thank you very much, and welcome everyone, and I am so grateful to be able to introduce the remarkable leader and my Congresswoman, Speaker Nancy Pelosi.
Thank you, Dr. Ehrlich, for your kind words, for your great leadership, and for the work that is done here. Yesterday, I was at the AIDS Memorial Grove honoring Jim Hormel, and we were talking, those of us there, about the incredible leadership of San Francisco at the time of HIV and AIDS. And you can't talk about that without talking about the role that San Francisco General played at that time, a model for the nation. So for a long time now, that goes back over 30 years, you have been, again, in the leadership of meeting the needs, whatever they may be, then AIDS, now COVID, all along the way, just meeting all of the health needs of America's working families. So thank you, Dr. Susan Ehrlich, for your tremendous leadership and, again, your hospitality. Helping to bring, listen to this, quality health care to more than 100,000 patients each year. Thank you. Thank you. We all believe that quality, affordable health care must be a right, not a privilege. The champions joining us here today were mentioned by Dr. Ehrlich, but I want to mention Preethi Krishtel, and she will be talking about affordability of prescription drugs, which is a major, I'll talk more about that, but major initiative for all of us. And Peter Lee, of course, our hero in Covered California for a long time now, again, a model to the nation. But our real VIPs are our constituents. These are our VIPs, our very important people, Aaron and Jakob Lubin and their daughter, Zosha. And they're going to tell their story. And their story is very important to all of this. When we were, telling me should I start all over? No, I won't. When we were fighting to preserve the Affordable Care Act from the assaults that were made on by the previous administration, we had 10,000 events across the country of people telling their stories. That is the most eloquent argument or case to be made for quality, affordable health care for all Americans. We thank the Lubin family for bringing their story to our attention, their generosity of spirit to do that. I just wanted to talk a little bit about the Affordable Care Act. It has made monumental progress in lowering health care costs for American families. In 2018, in that election, our first principle for the people was lowering health care costs. Bigger paychecks, cleaner government, but first and foremost, lowering health care costs. And again, since then, we've expanded health care coverage to 31 million Americans. And in addition to that, to having transformational protections for over 150 million families who already had health care, but better benefits at lower cost. And of course, the biggest, something that affects over 130 million Americans, making health care available to those with pre-existing medical conditions. And by the way, at the time, before we passed the Affordable Care Act, being a woman was considered a pre-existing medical condition, no more. But again, despite the decades-long attempt by the other side, the Republicans, to take this down, it still is a pillar of health and economic security. It ranks up there, the ACA, with Medicare, Social Security, Medicare, Medicaid, the Affordable Care Act. And now we even have more formidable additions to it all as we go forward. During the pandemic, the ACA has been a vital lifeline for struggling families. That caused job losses, but the legislation that we passed enabled people who were unemployed to participate at the lowest possible cost with the maximum possible benefits. Again, it would have been important at any time, but during COVID, very essential. And I know that our guests can speak to that as well. And that is why the Biden administration and congressional Democrats took action to strengthen the ACA, making health care more accessible and affordable. It's called the Affordable Care Act. We're always striving to make it more affordable. President Biden established a special enrollment period allowing families who lost coverage during the pandemic to purchase insurance at the ACA exchanges. 2.5 million families signed up nationwide, 364,000 here in California. Thank you, Peter Lee. And in Democrats' America Rescue Plan, which was passed in March, Congress dramatically lowered the cost of insurance premiums for people buying insurance on their own. Average monthly premiums fell 27%, nearly, as I said, 2.5 million, even in California. Now, this is a bigger number, became eligible for new or enhanced subsidies. 700,000 Californians are now getting a quality plan for just $1 a month. For just $1 a month. Now Democrats are seizing the once-in-a-century opportunity to lower health care costs for families for good. Many of these measures are COVID-related, and for a couple of years and stuff, we want to do this permanently. As we advance our Build Back Better agenda, House Democrats are fighting to extend and expand the historic progress for lower health costs in the rescue plan. It's outrageous that Big Pharma gets away with charging drug prices in the United States that do not charged anywhere else in the world. American consumers and patients are subsidizing cheaper prices for people overseas, while they're on track to spend more than $1 trillion, the pharmaceutical companies, $1 trillion on stock buybacks and dividends. Many parents are in tears. I see grown men cry as they go around the country because they're unable to keep up with the cost of life-saving medications. And that is why we will not relent until we can pass H.R. 3, the Elijah Cummings name for Elijah Cummings, our dearly departed, drug costs. The Elijah J. Cummings lower drug costs now, saving families hundreds, if not thousands of dollars a year. As Democrats advance our Build Back Better agenda, the leadership of everyone is important. This is a consensus in our country. It's transformative. It crosses a threshold. People should not have to worry about the cost of health care. It's a health issue. It's a financial issue. It's central to the kitchen table concerns of America's working families. President Lincoln famously said, and I quote this all the time, public sentiment is everything. With it, you can accomplish almost anything. Without it, practically nothing. But for public sentiment to prevail, people have to know. So I thank you all for being here to make sure that you can contribute to a drumbeat across America in our community as well. And now I'm going to yield to our real VIPs, as I mentioned earlier. Their generosity of spirit to share their story will make all the difference in the world for them, hopefully, but also for so many others. Erin Lubin, her husband Jakob, and Zosha are with us. Erin, thank you for joining us today, for the courage and generosity, as I said, of spirit to share your story. I'm pleased to yield the podium to you.
Thank you, Speaker Pelosi. My husband, Jakob Moser, and I are professional photographers who have lived and worked in San Francisco for 20 years. We earned our degrees in photojournalism from San Francisco State University and married shortly out of college. We worked hard to establish our professional careers independently and as a husband and wife photography team. We established clients in the journalism, corporate, and nonprofit sectors and have been able to support ourselves and our family through our small business. We have been careful with our family budget and had emergency savings. When the pandemic hit, our work, which depends heavily on human interaction, stopped. All of the jobs we had on our calendars were either canceled or postponed indefinitely. Our daughters, Maya, 5, and Zosha, 12, were now at home full-time, and we were faced with the terrifying prospect of no income for who knows how long. We did our best to tend to our girls' schooling while keeping a positive face toward the unknown. We began looking for ways to reduce our spending so we wouldn't have to dip into our savings to pay for basic necessities like rent, groceries, and health care. Thanks to the Affordable Care Act, even though Jakob and I lost our work, we did not lose our health coverage. Once we assessed our reduced income for 2020, I called Covered California with the new numbers and was deeply relieved to hear that our premiums would be lowered significantly. This helped ensure that we had enough money in the bank to keep supporting our family through the lockdown. As the pandemic has evolved, some of our work has returned, but our income is still greatly reduced. Thanks to the American Rescue Plan, we qualify for enhanced benefits that bring our premiums down even more. We feel incredibly fortunate to have this access, and we know it is vitally important for families like ours, families with unpredictable income, to have the security and peace of mind that comes with access to quality, affordable health coverage. And actually, I feel the pandemic has shown us that any family could have an unpredictable income due to forces beyond anyone's control. Hardworking Americans like Jakob and I had the American Rescue Plan available when we needed it as a safety measure. As we all know, there were uncomfortable surprises almost daily during 2020. The pandemic, the wildfires, the civil unrest, etc. For our 12-year-old daughter, Zosha, 2020 would also bring a diagnosis of type 1 diabetes, which is an incurable chronic autoimmune disease that will require her to have daily insulin injections for as long as she lives. In July of 2020, following an onslaught of symptoms, we spent 3 days in the hospital while the doctors got Zosha's blood sugar levels back in range and taught us how to do the work of her pancreas. We left the hospital with 2 grocery bags full of medical supplies and the knowledge of how much this life-saving care could cost. Zosha now uses an insulin pump, a constant glucose monitor, and is dependent on at least 1 vial of synthetic insulin a month. Depending on one's health coverage, these life-preserving necessities could cost many thousands of dollars per year. While we are fortunate that Zosha is covered by Medi-Cal right now, we fear that someday she will have to bear these stifling costs on her own. We hope that Zosha will have even better options to manage the costs of her condition when she is an adult and navigating the world of health coverage, which is why we support Speaker Pelosi's efforts to pass the Lower Drug Costs Now Act.
No kid should have to go without the care they need as a result of their parents' income. Health care should be seen as a basic human right for every citizen, not a luxury. I hope Speaker Pelosi and the rest of Congress will continue to work towards making healthcare more affordable and prescription drugs like insulin more affordable so that families are not crippled by the cost of medical care. Thank you for your work, Madam Speaker, so far.
We just wanted to say the last sentence.
We are so grateful to you, Speaker Pelosi, for leading this fight, and we stand behind you as you work to bring down healthcare costs for families like ours and the entire nation. Thank you.
As I said, nothing more eloquent than the stories, the personal stories that, of course, families are willing to share, and we thank the Lubins for all three of you participating in all of this. And before I introduce Prithi, I just want to say that we will continue to invest heavily, as we do in our legislation, in the basic biomedical research to find a cure for diabetes, type 2, juvenile diabetes, all of it, because it affects so many families in our country. Sometimes you hear the pharmaceutical companies say, if you lower the cost, we won't be able to make the investments in research and development. No, we're making billions of dollars of research in basic biomedical research, which is fundamental to the further research that they do. And their argument would have more claim if they weren't spending even more money in buybacks and CEO pay and dividends and the rest, as well as, in some cases with some of the companies, more money on advertising than they spend on research and development. One more point in this, insulin has been around for a very long time. Certainly whatever cost for research and development that went into that should not continue to be carried ad infinitum forever and ever. So let's be realistic about the cost in all of this. And a real champion in all this is Prithi Christo. She's Executive Director of Initiative for Medicine's Access and Knowledge, and I particularly want to commend her for the justice aspects of it and how this particularly affects communities of color and previously underserved communities, and the centrality of the cost of drugs to that affordability. Thank you, Prithi, for your leadership. Welcome.
Thank you, Speaker Pelosi, and good morning, everyone. Prescription drugs in America today are 2.5 times as high as other high-income countries, and they're rising at a breakneck pace. 1 in 8 Americans has lost a loved one in the last few years, and that's twice as true for communities of color. Since the pandemic started, 1/10 of Black and Latino families and 1/6 of Indigenous families reported being unable to afford their medication for a major health issue. And prescription drug spending overall has reached record highs. In 2019, that number was $370 billion. And by 2028, it's going to be $560 billion unless we get systemic reform that reins in the anti-competitive abuses of the pharmaceutical industry. Today, we have an imbalance between drug makers on the one hand and the people on the other. And unless we get systemic reform, that's not going to change. Right now, drug makers are extending their monopolies as long as possible to keep prices high. Take the case of Humira. It is the best-selling drug in the world, but in America, competition has been blocked until 2023. Our friends in Europe started to get competitive, more affordable products in 2018. And in the 4 years since that time, Americans are going to spend $70 billion on this drug alone. But it's not just about one drug. Keytruda, a cancer drug, is poised to be the next Humira. And Keytruda is going to be actually in the next few years the top-selling drug in the world. Now, when you look at this drug, since 2014, when it entered the market, the price has gone up by 147%. 147%. Medicare, on average per patient, is spending $54,000 on this one drug. Now, how did we get here? Well, the company that owns Keytruda has filed 129 patent applications on just one drug. They've already gotten 53 of those patents. And what that means in real terms is that their monopoly got longer by an extra 8 years. And in those 8 years, America is going to spend $137 billion on one drug alone, unless we get systemic reform. Now, like Speaker Pelosi said, the industry will tell you that they need these costs to pay for innovation, but the innovation that we are seeing today is legal innovation, where industry lawyers are playing patent games and keeping monopolies going on just way longer than Congress intended. So here's the rub. We know that there's no silver bullet that's going to solve the drug pricing crisis overnight. But for the sake of American families, for our health, for our economic security, we need the federal government to have the power to negotiate on our behalf. We need them to rein in these anti-competitive abuses like patent gaming that are keeping prices far too high for far too long. Prices in America on prescription drugs are the highest in the world, and they are continuing to rise. American families deserve better. Thank you.
Thank you very much, Priti, for your leadership and the clarity of your message. You have defined the challenge that we have. We'll talk more about it, I'm sure, during the Q&A. But right now, I want to bring to the podium really a hero for all of us in terms of affordability and health care in California. Peter Lee is the Executive Director of Covered California, and from day one, his leadership has served, again, as a model for the nation about how we could deliver quality, affordable health care to many more people in a way that is fair and just and overcomes previous underserved communities. Thank you, Peter Lee, for your leadership. He comes from a family distinguished for its service to affordability and innovation in terms of health care. They all will be very proud of his leadership. I certainly am. Peter Lee.
Madam Speaker, thank you so much. Thank you also, Dr. Ehrlich and San Francisco General, which has been a national leader. Preeti Kishtel, thank you for your message around the high cost of prescription drugs. And in particular, thank you to the Lubin family. Is that this is, as the Speaker noted, the real VIPs are the individuals who are willing to tell their story so other Californians and Americans can hear that they now have, because of the Affordable Care Act and the American Rescue Plan, a way to actually have truly affordable health care. We saw with the Affordable Care Act, California take the lead in the nation to reduce the rate of uninsured more than any state in the nation, going from 18% to 7%. You heard here at SF General, they used to have 40% of their patients uninsured, now virtually none of them. That's because of the Affordable Care Act. Today, we have millions of Americans, hundreds of thousands in California, benefiting from the American Rescue Plan. The American Rescue Plan was put forward by President Biden under the leadership of the Speaker to provide additional help to make the financial help of the Affordable Care Act even more meaningful. What's that meant? It's meant here in California, we now have 1.6 million Californians covered through Covered California, 90% getting that financial help. As the Speaker noted, since we closed open enrollment last February, we've had 364,000 people sign up for Covered California. That's about 200,000 more than would have normally signed up. 200,000 Californians brought to affordable health insurance because of the American Rescue Plan. And during that enrollment, we've seen a higher proportion of Latinos, of African Americans signing up. These are the communities that have been hardest hit by the COVID epidemic, but also hardest hit by the financial effects of the recession caused by COVID. So the American Rescue Plan has meant that 1.4 million Californians, like the Lubins, are getting a financial leg up with more help than they could have gotten before. It's real savings. It really is making health care more affordable than ever. And I want to put some numbers around that. The American Rescue Plan builds on what the Affordable Care Act does, provides more financial help to people that need it more, people that have financial uncertainty like the Lubins, people that make less money. If you are a Californian making, as a family, less than $50,000 a year, on average, those families are paying $35 a month for coverage that might cost $1,000. $35 a month on average. And as the speaker noted, in California, 2/3 of those people are paying $1 a month for very good coverage. This is providing financial help to those who need it most. The American Rescue Plan, though, also addresses one of the flaws of the original Affordable Care Act. It builds better on a good program. It says if you're a middle-class American that knows you've got decent income, that means as a family you're making $100,000 or even $150,000, you now get a leg up with help paying for your health insurance coverage. On average, Californians making up to $150,000 eligible for financial help are getting $800 a month to lower their health care costs. This is the recognition that health care costs is too affordable for anyone that doesn't have employer-based coverage. We need to address that. The American Rescue Plan and the Affordable Care Act are addressing that concretely, and it's making a difference for people like the Lubins, small business owners, working people who need that leg up. We know that the American Rescue Plan builds on one of the pillars of economic and health justice in America, the Affordable Care Act. It does that right now temporarily through 2022. And as Congress and federal lawmakers look at the future of the American Rescue Plan, they need to look at people like the Lubins, people in California, but in every state in the nation that are benefiting as families with lower premiums, health care that is truly affordable, and that affordability need does not go away at the end of 22. It's a permanent need, and the American Rescue Plan can and should be a permanent fix for American families. With that, I want to thank so much Madam Speaker, who has led the nation, as California has led the nation, by showing how to make the right policies and then how to implement them well to make sure all Californians and all Americans benefit from health care that absolutely should be a right and not a privilege. With that, I will turn it back to Madam Speaker. Thank you so much.
Thank you very much, Peter Lee, Executive Director of Covered California. As you were ending your remarks, you referenced what we did and what we did in the rescue plan, how important that has been, but that we need to do more as we go forward. And that is what we're striving to do now with the reconciliation, the Build Back Better legislation that President Obama has put forth. And that is to make so many of these initiatives, not just a couple of years relating to COVID, but permanent, so that people can depend on it, have the leverage to make decisions in their lives, knowing that they will not be bankrupted by the cost of health care. May I just say about the prescription drugs? In 2005, when we first made our attempt to win the House, we had for that 2006 election, we had something called 6 for 06. 6 bills we would pass in the first 100 hours of the new Congress when we won. We did win. 5 of those bills became law. The 6th one we passed in the House could not get 60 votes in the Senate. We didn't have 60 in the Senate, and therefore it did not become law. And that was legislation to enable the Secretary of the HHS to negotiate for lower prescription drug prices. So we've been on this case for a long time. That's what the Elijah Cummings H.R. 3 legislation would do, enable the Secretary to negotiate for lower prices. This is important to families and individuals because when we originally did it, we just did negotiate for Medicare. But in H.R. 3, it's for Medicare and for private citizens, for the private sector as well. So this is a big, important leap forward, and this is what we're hoping to get in the reconciliation, and that's part of that debate. But something must happen in that regard. We want it to be the best possible and strongest initiative for the people, because it affects families, it affects corporate America who's paying the bill, small businesses, it affects the taxpayer who's carrying the load for subsidizing big pharma for them to have big profits while charging so much. So that is, again, as I said earlier, I've seen grown men cry across the country as I travel because of the burden and of uncertainty and the cost of prescription drugs. With that, I'll be pleased to take any questions you may have. We'd like to focus on the subject at hand first, but I'll be pleased to answer any other questions you may have. Yes, ma'am. Yeah. I hope not. Well, right now we still have, according to the rescue package, this will last for a couple of years. Hopefully we will be rid of the pandemic long before all of that. But we're there to meet the needs of the American people. We want, again, whether there ever was a pandemic or not, we had the need to lower cost, and that is what we attempt to do. Dr. Lee, Peter, did you want to speak to that?
That again, the American Rescue Plan was specific to the pandemic, and these benefits go through 2022. We've already signed up hundreds of thousands of people to have benefits right now. In California, we are open for enrollment right now. So if people are uninsured today, they can walk up to our doors, go to coveredca.com and get insurance that will be for the balance of 21. But we're already doing planning to enroll people throughout 2022. The issue before Congress, though, is 2023 and ongoing. As the speaker noted, the American Rescue Plan lowers costs in ways that need to be permanent. That irrespective of the pandemic, we have people who have families with diabetes, with cancer. Lower income Americans need more financial help. That's exactly what the American Rescue Plan models for a permanent need that Congress will have before it in the next 4 months.
Thank you for your question. Any other questions on the subject at hand? Boosters. Well, I think we have to do both. The fact is that we are learning. The data shows that those who had received booster shots, say 8 months ago or something, the protection is waning. We do have knowledge of who that could be at nursing homes. Though mostly people got it earlier with those with a pre-existing disposition to be receptive to the virus, but also older people and the rest. I put myself in that category, and so we have that responsibility. But we also do have a responsibility to the rest of the world, because unless we're all protected, none of us is really protected. There are initiatives. We are sending out some vaccine. We have to strive to do more, and we cannot ignore what the rest of the world wants. Any comments on that? Okay. No other subjects on this? Questions on this subject? No? Yes, sir. Yes, well, when I first went to Congress, the first thing I said on the floor of the House, I said that I told my constituents that Sala Burton, that Sala sent me, and I'm here to fight HIV and AIDS. That was my very first words on the floor of the House. Some people were startled by that because they still were just not used to accepting that as a priority for a member of Congress. But we have been very blessed in our community, really starting here, Dr. Paul Burbergy. So many leaders in our community were on the forefront of community-based care, community-based research, community-based prevention. Community-based, I say that over and over again, listening to the community. It served as a model for the nation when we wrote the Ryan White Care Act. Much of the intellectual resource of it came from here, and again, from the standpoint of care, from this very institution, San Francisco General. So yesterday we were there talking about where we go from here on that subject, but I also had the sad privilege of placing flowers at Jim Homel's name there, who had right from day one at the start of the AIDS epidemic used his philanthropy, his leadership to help fight against HIV. Just one thing I will say, when this more than a year ago, I called had a phone conversation with the head of the World Health Organization, and I said, tell me, how has our fight against HIV/AIDS helped in this fight on COVID? For example, something that was bipartisan with President Bush, the PEPFAR an initiative to get drugs in an affordable way into communities so that people would no longer feel stigmatized, but hopeful about if they revealed their status. And it has been important in terms of the science, in terms of the distribution of clinics, in terms of the receptivity that people will have to something new. And I salute President Bush for his ongoing interest in all of that as well. Okay. Yes, sir. Any comments you want to make about the institution, the affordability,
and then Dr. Susan Ehrlich, Chief Executive Officer here. I just want to make a comment about weaving in this idea of the Affordable Care Act and the service that we provide here on campus. We've been here for more than 150 years, providing care to the community through any number of plagues: smallpox, bubonic plague, tuberculosis, HIV/AIDS, and now COVID. And what I've seen in the past year and a half is what it is. Why is it that we've been able to do this so effectively in this place? And it's because we live in a city that is supported by the leaders, it's supported by the community, it's focused on the community, and it uses science, data, and facts to respond to the problem at hand. It's why we have the lowest death rate from COVID in the United States. We have the highest vaccination rate, one of the highest vaccination rates in the world. And our hospital has been busy, but we've done relatively well in the United States. And so I just want to express my gratitude to the speaker for being one of those leaders, and to this community for supporting us in the work we do. Thanks.
I'll just respond to the question about the booster shots and the global vaccine equity. You know, I think as Americans we have a tremendous responsibility today to really think about the rest of the world. Many of us have received first or second doses, and there are so many people in countries worldwide that are surging across Africa. India just went through its surge, Indonesia, Brazil. So I think we have a tremendous responsibility as Americans to be advocating for people all over the globe. And then at the same time, as a mom, I'm thinking about my child starting preschool in 2 weeks, and I'm wondering when my kid's going to get vaccinated. So I think I just want to recognize that these are really complicated decisions before us, and I really love how the speaker put it. It doesn't have to be a but, it can be an and we have to get ourselves out of that scarcity mindset and really figure out how we're going to expand the supply of vaccines so everybody everywhere can get vaccinated.
Thank you so much, Priti. I just want to say that this institution, San Francisco General, has had many great leaders to, again, give us confidence, meet the needs of the people of our area. As a trauma center and the rest, everybody had to know how to get to San Francisco General, a leader not only in our city but in the West. But all of them would be very proud of the leadership of Dr. Susan Ehrlich, the CEO of the hospital now. She has just brings so much knowledge, judgment to the position that she holds, and I join her in commending our leadership in our city. Mayor London Breed has done a wonderful job. I get a daily report from my staff member, Dan Bernal, who's the chair of the San Francisco Health Commission, that the pandemic the rate is decreasing in San Francisco because of precautions that are taken. I've asked about mandates federally, but the mandates locally here, for example, have enabled us to proceed, some that will come into effect next week, proceed in a way that reduces the spread of the virus. And I salute the mayor. Also support Gavin Newsom for what he is doing. The campaign against him now is using. They want to take down any mandates for masks, take down any recommendations for vaccinations. That's their campaign. So this recall has become a matter of life and death when you see the other side opposing the initiatives put forth by the governor for reducing the pandemic in our state. You had a separate question, sir?
Yes. What do you have to say to the women of Afghanistan?
Yes. Well, the women of Afghanistan women and girls in Afghanistan have been a very high priority for many of us in Congress, Democrats and Republicans alike, House and Senate, White House, President Laura Bush, Michelle Obama, Jill Biden, all of us have had that as a high priority. Quite frankly, I think some of the support for our presence in Afghanistan across the country sprang from the interest of the American people of the fate of women and girls in Afghanistan. I've been in Afghanistan 9 times, many times led by Susan Davis of California for a Mother's Day visit. Well, of course, our whole purpose is security, to thank our troops, some of them moms, some of them grandmoms fighting the war, and also to remind some of the others to call home for Mother's Day, but nonetheless also to visit the women in the hinterlands, not just in Kabul, that's obvious, but doctors, professors, lawyers, judges, women that are highly visible, and the need for us to protect them, but also the poorest of the poor women throughout the country, and seeing their girls go to school, to see the next generation to have opportunity that they did not have. So we have to make this a subject of the greatest transparency, shining the biggest, brightest light on what the Taliban may do. So far, we're not, where they're painting over beauty salons and things like that. We'll see where it goes from there. But people ask me, do you trust them when they say we're not going to change we're not going to hurt women and the rest? We'll see, but we can't take that chance. I've just seen that Malala, lovely Malala, who has been so courageous, is speaking out on this, and I have a call into her to say, any way we can help you, but we do want that. Now, you give me an opportunity to say that please call our office if you have a concern about Afghanis, about people getting out. What do we say? Let me give the right, because I have so many... websites, but this one is, I'm sorry? Pelosi.house.gov. Pelosi.house.gov. That's my San Francisco place for you to call. We have speakership thing, this, that, want to go there. And then we are in touch with the State Department about specific cases with NGOs there. Let me just say that I was very proud and spoke to my colleague Jason Crow this morning, who took the lead on the visas for those who helped us there, and largely helping in the military aspects of it. But many NGOs were helpful there, Roots for Peace, local to us here. Also, there are other groups that were helpful that were not U.S. NGOs, but NGOs there that need that relief, that visa relief coming out. The my most recent communication from DOD this morning was that they've identified a large number of Americans, we're just talking Americans right now, who have visas and need to get out. Well, they're Americans, they don't need a visa. But the question is, how do you get them to the airport? And that's a question of the intentions of the Taliban as well. So this is all-consuming in every way. San Francisco is a very welcoming place, has always been there. When we had the Muslim ban, remember that over 4 years ago? Well, that was a direct hit on the people who helped us. And therefore, the diplomats and military and all came forward and said, we have to get rid of the Muslim ban because that hits the people who helped us so much in Iraq and Afghanistan. And at that time, I just always like to say this because I think it's important. At that hearing that we had, of course it was a rump hearing because we didn't have the majority, but we had it anyway. At that hearing, the leader of the American evangelicals, the evangelical community, came to oppose that Muslim ban, and he said this, he said, the U.S. refugee resettlement program is the crown jewel of American humanitarianism. We just have to remember that and be more welcoming, especially to those who helped us, but nonetheless for those who have a well-founded fear of persecution wherever it may be. So again, it's about values. It's about values of our responsibility to other people, as other countries, other people affected by all this. That's why I was asking about HIV/AIDS. Could we use that mechanism to be able to get more drugs to more people to fight the pandemic in the southern hemisphere specifically? Is that it? When, yes, sir. Well, let me just say, with all the respect in the world for you, my constituent, my boss, I always say my constituents are my bosses, that I owe you candor. And I believe in health care for all Americans. I believe the route that we are in expanding, please I listen to you, expanding the Affordable Care Act. Now, we do have in our reconciliation package that we're hoping to pay for with the prescription drug money, but nonetheless we have in our expanding Medicare benefits, hearing, visual, and dental, so that is a better benefit. But frankly, the Affordable Care Act benefit is a better benefit. And that we share one view, and that is we want health care for all Americans. Thank you all very much. Thank you.